We had a great day today here at Blanchfield Army Community Hospital. We had our VA partners from Tennessee Valley and also the VA Central Headquarters up in Washington, D.C. And they're down here really talking about relationships and opportunities. There are lots of opportunities for the VA here at Blanchfield. We've incorporated some VA care into Blanchfield Army Community Hospital already, and we're looking at opportunities to grow that. Because really, there are a couple things that help us as an organization when we bring our VA patients in here. Number one, it helps from a readiness perspective to make sure that we're really building readiness within our organization so that our providers are ready to go downrange when they're called upon, and they have the acuity level of patients, those sick patients that you need to care for, to make sure that you're ready from a medical provider standpoint.
There's a definite growth here in the market area of Fort Campbell for veterans, and so that's one of the reasons why it comes up. One of the busiest markets in the VA is in the Nashville area, which includes Fort Campbell. So yeah, the population growth is that, but it's not just the population. Anywhere there's veterans, we want to provide care, because we're looking at all markets, both rural and urban. This is kind of a good mixture of that too. So you've got the areas that we need to make sure we're putting the point of care for those veterans that's most convenient for them, so we can provide care for all veterans that we can.
This isn't a we should do it when we get around to it. This is a must do. We must do it to be able to benefit our beneficiaries for sure. Access to care is the primary motive, if you will, creating more access to care by collaborating together.
Today, just hearing the conversation of those in the field, taking care of the actual veterans and taking care of the actual patients is most critical. So I want to learn from that directly so we can translate that into what we do with the strategic planning, the strategic analysis, forecasting the future of both organizations.
Independently, we can only do so much. Together, we can take it up another level in terms of providing care. But it's not just about providing care, it's about providing the best care, having excellent outcomes. And for example, we have women veterans who are having children. BACH happens to do that very well. So could we not send our veterans who are pregnant here to BACH for their care and their delivery? Actually, we can. We just haven't taken advantage of that very well before because of the collaboration. So we've started that. In this fiscal year, we've referred nearly 40 of our veterans who are pregnant here to BACH for their primary care and getting them ready for their delivery. That's amazing, and that's what should be happening.
And even more critical is that partnership and really the integration between the military health system and the Veteran Health Administration and our integrated health system. So the vision is to bring together our two systems closer and closer as much as we can to help that transition from the DoD into the veteran. And so the vision of the future is to really strengthen those partnerships. And I think this market is one of the prime areas where we can strengthen that.
Coming in the very near future, we've already set aside some space, Colonel Myers has, in the hospital campus for primary care to join the set here so we can continue to see our veterans as well. We're outgrowing our space in the VA set here in town, as well as dental. Dental's another area where we have opportunities perhaps to partner with the dental command here on post to provide more care for our veterans.
One of the priorities is for our secretary is the DoD-VA partnership. And it is a priority. This is one of the 5 top priorities identified during our 4-year market assessment. Fort Campbell was in the top 5. So a very important area for both the VA and I know for the DoD.
These readiness partnerships that we've developed with the VA continue to grow every day so that we can take care of not just our own patients, but our VA patients that are out there. Really for the VA, this is really an opportunity for them, because in this building every day, our employees, some of our employees get their care in the VA. Some of the employees in the Fort Campbell community get their care in the VA, and even just outside these gates. And the opportunity for them to come to Blanchfield, to go to the VA clinic and an opportunity there to get their care, it really helps them in their day-to-day activities where all of us, we never have enough time in the day. And so by saving some time and not having to go downtown to another clinic, and they can get their care here, it's just a great opportunity. It's really a win-win for everyone.